Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, amid the COVID-19 pandemic, several hospital groups are considering the possibility of cutting ties with PhilHealth over its circular showing mistrust on payment claims. But the state health insurer insists that suspending payment claims is part of its anti-fraud measures. And later, COVID-19 patients in home isolation can now also be covered by PhilHealth, but there are certain conditions. PhilHealth Spokesperson Shirley Domingo and Private Hospitals Association of the Philippines President Jose de Grano join us live. Three hospital groups announced on Saturday that they are planning to disengage with Philippine Health Insurance Corporation, or PhilHealth. The statement comes over what they call mistrust coming from the state health insurer. The agency recently reiterated in a circular that it will be suspending payment of claims supposedly linked to fraud. Meantime, PhilHealth also announced that it will be covering the cost of home isolation of eligible COVID-19 patients. Let's go straight to the source of the story. We have PhilHealth Spokesperson Shirley Domingo. Ma'am Shirley, welcome to the source, and thank you so much for your time.
Good morning, Pinky, and good morning, everyone who's listening or watching this program now. And thank you also for inviting me.
You're welcome. Let's start with the home isolation package. So PhilHealth is now going to offer COVID-19 home isolation package for, let's be clear about this, mild and asymptomatic patients who meet the social and clinical criteria for isolation. Exactly what does social and clinical criteria mean so that one will be able to avail of this COVID-19 home isolation package?
Yes. Well, the social criteria means that since they will be doing home isolation, and we assume that there are some people there also together with them in their house, then there should be at least a room that they can isolate in. So there should be a room in the house that they isolate in, one. Secondly, that there should also be a bathroom that they can use on their own. Because if they go out of their room and use a common bathroom, then they will be able to expose themselves to other members of the household. Therefore, that cannot be allowed. Hindi sila makakwalify doon. So there are other requirements rin, like there should be a caregiver or at least a member of the family who will be able to take care of his or her everyday needs. So yun po ang social criteria. Now, as to clinical criteria, it will be just the general, does he have fever, any other clinical criteria, making sure that it is a mild or asymptomatic case of COVID.
I'm Shirley, who's going to determine that?
Excuse me?
Who will determine that I just have a mild case? For example, let's put it into context. Somebody is at home. Okay. Nagpa-test po siya. Siyempre, kailangan po, number one, positive yung kanyang RT-PCR. Ano po? Nagpa-test siya. So, asymptomatic siya. So, kailangan siya mag-isolate o kaya meron siyang konting lagnat, meron siyang konting ubo o sipon o pananakit ng katawan. How does one actually tell PhilHealth that I want to avail of this home isolation package because I'm actually positive of COVID-19 and I am isolating at home?
Okay, let's clarify that this benefit will not be filed with us by the patient themselves. It will be filed by the providers, not the patient. So if someone will be able to or is diagnosed with a COVID, tapos mild and asymptomatic lang siya, as determined by a provider, no, a physician, then pwede sila mag-avail ng benefit na ito. We'll be coming out with a list of accredited providers, and they're actually our existing providers now. They just have to give us a letter of intent, and they can choose their provider there, and it will be the provider who will be providing the services that are required under the benefit and file the claims with us. It's not the patient who will file the claim
I
with us.
see. So when you say providers, Ma'am Shirley, are we talking about health insurance providers? Yung pong meron pong may mga insurance na privately given to them or given to them by their employers? Ganun ho ba yun?
Oh, no. We're talking about clinics or hospitals or consulta providers. We have existing consulta providers. So sila magbibigay ng services to the patient at sila ang magpo-file ng claim sa amin. And may I clarify also that this will not be applicable in all regions or in all
High
areas.
risk.
It has to be in a identified area that has a surge identified by the IATF.
Okay, so give us an example how one actually goes through this. Paano ho ito gagawin ng isang tao? Kailangan ho ba nag-teleconsult siya? Kailangan ho ba may kausap siyang doktor? Paano ho?
Okay, as soon as the patient is tested positive, no, RT-PCR positive, and has mild or mild symptoms lang or asymptomatic, then pwede siyang pumili doon sa list ng aming providers, and pag napili na niya yung provider niya, there are services that are mandated under this benefit. One is that the provider should do an initial consultation with the patient, and it should be face-to-face. Yun po. And then there should be like at least 2 or 3 more consultations. Yun pwedeng virtual. But there should be a nurse man lang who will be able to answer the needs of that patient 24 hours. So the patient has also to have a facility or a phone to be able to do virtual consultations with the providers. There will also be a kit that will be given to that patient, and it will contain pulse oximeters, thermometers, some supportive treatment like antipyretics. Yun po, kasama yun doon sa kit na ibibigay sa patient. So
okay.
There should also be facilities or a MOA with other higher referral facilities just in case the patient deteriorates.
Opo, pag lumala po yung kanyang sakit. So sabihin po natin, meron po may sakit, nag-RT-PCR po siya positive. Does that mean that that patient will have to call one of the healthcare providers that PhilHealth will be identifying? Tama ho ba? And then
yes,
he or she will consult that kunwari healthcare provider A. Tatawagan po niya yon, sasabihin niya, COVID-19 positive po ako. So si healthcare provider has to bring in a nurse to the patient's home to check the patient, and thereafter there has to be at least 2 or 3 virtual meetings again, and that healthcare provider will be the one claiming for the patient.
Yes, it will be the healthcare provider who will claim that claim for the patient in behalf of the patient for us. The money goes to the provider because the expenses will be that of the provider. So it will not go to the patient.
I see. Opo.
Yeah.
So si healthcare provider, aalagaan po si pasyente habang nasa bahay. Kaya habang inaalagaan po niya si pasyente, si healthcare provider ang magka-claim po nito sa PhilHealth para bayaran po si healthcare provider.
Yes po. It will be like an inpatient, but instead of in the hospital, it will be at home. And by the way, we will also be including, we had talks also with the ILG here, because we will also be requesting the assistance of the BERT, the Barangay Health Emergency Response Team. Sila yung unang mag-a-assess ng social criteria sa bahay ng patient. Because pag nag-positive naman ko ang isang patient, they really have to report naman to the barangay, di ba? Para ma-monitor at ma-contact trace. So sila yung unang in contact with that patient.
I see. But while, how soon is there a mandate from the healthcare providers to be able to physically see the patient once the patient calls a particular healthcare provider?
Yeah, once that patient chooses a healthcare provider, it's just like choosing your doctor. No? So once the patient chooses the healthcare provider, then the healthcare provider, who we will assume will already know the the benefit package, no, because we'll also be orienting our accredited healthcare providers on this. Then, yun na, they may mga mandatory services that they should do, which I already
I see.
mentioned earlier, like
Okay.
consultations, provision of kits, etc.
Magkano po yung health package?
The package cost 5,719.
For the whole time that the patient is isolating?
Yes, a maximum of, a minimum of 10 days. Because that's the requirement of the Department of Health, 10 days
Yes,
isolation.
yes. So what they get is more or less over 5,000 pesos, the healthcare provider. That's what they get from this home isolation package of the patient.
Yes, yes.
Okay.
Yes, that's true. And
but when does this begin?
excuse me?
Kailan ho ito i-implement?
Okay. It was published, I think that was August 19, and therefore it will be effective 15 days after. That would be around September 3.
September 3. Okay, we'll be taking a very short break. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, PhilHealth Spokesperson Shirley Domingo. Ma'am Shirley, let's talk about this circular 2021-0013 that hospitals are very unhappy about. PhilHealth is saying that this circular is really just a reiteration of a 2016 circular wherein you're looking into payments or claims by hospitals that could be questionable or fraudulent. So what is the difference of this circular now in 2021 compared to the circular in 2016?
Okay. Actually, the temporary suspension of payment of claims, we call TSPC, this is only a part of that circular in 2016 and 2018. It was revised in 2018. This is only Section H, no? In that circular, there is already due process once we do some monitoring of the hospitals. And I will not mention step by step those process. But anyway, in this new circular, we actually added additional provisions to ensure due process. One is that it's very clear here that a TSPC, before it will be implemented and given to the hospitals, then it has to be approved by the president of PhilHealth. But this is not mentioned in the previous circular. So now it is mentioned here. There is another provision there that says that after the TSPC and there's still doubt about the claims of the hospitals, then the hospitals can still be subjected to a provisionary accreditation for 6 months. We removed that actually in this new circular. So natanggal na yon. So after 120 days of that probationary period, I mean the TSPC period, then start na yung bayad ng ating claims to that hospital. Meron sinasabi ang hospitals na it should be, it's actually 240 days, but it's not actually, no? Because we would want to clarify that the extension of 90 days is for the investigation only. After 120 days, claims started to be paid, the claims after that period. Any extension will only be because of the investigation of that existing claims.
But they're very unhappy about this because if you're saying basically that this is adding due process to what is or has already been implemented, simple or basic thinking would mean that dapat maging masaya mga ospital, pero hindi. What in fact is they're saying that there seems to be some mistrust between hospitals and PhilHealth.
Yes, that's true. That's their position. I don't know why, but maybe they did not realize until we came out with our statement that this was already an existing policy. I really don't know. Maybe Dr. Grano later can explain that. But if you compare the previous two circulars with this circular, then they should realize that this actually adds additional process for due process, additional steps for due process.
So mas nakakaganda pa po ito para sa kanila because of these added provisions on due process, mas magkakaroon sila ng pagkakataon to answer any questions that PhilHealth will be forwarding to them regarding claims. Is that what it means?
That's true. That's exactly true. As I mentioned, this is only one step of the whole process, which started in which is mentioned in those two circulars. Before it becomes an investigation report, there will be two times that it will be given back to the hospital. One is at the beginning of the investigation report when we see adverse monitoring findings. It will be given to the hospitals and given 10 days to justify or to refute our findings. And if it's not refuted and still an adverse findings, then it will continue in the process until an investigation report and a TSPC will be recommended. Once that's recommended, this is the new circular now, it will be given back to them and allow them to answer for 3 days before it will be processed up to the president of PhilHealth for approval. So the hospital has a lot of time to answer the monitoring findings.
Yeah. So how I'm understanding it, Ma'am Shirley, is you're giving the hospitals more time to actually answer questionable or suspicious transactions. But what they're saying is, it seems like with this circular, that with this circular, you can suspend payment on mere suspicion.
As I mentioned earlier, with the monitoring findings that will come out with, it will be given to them for them to answer. And therefore, it's not only a suspicion. We will wait for their answer before coming out with a final investigation report and a recommendation for TSPC if ever it is warranted.
Yeah, but when just for clarification, ang PhilHealth ho ba, pag may nakikita ng posibleng problema sa mga claims, it deems it as suspicious, you temporarily suspend that, right? Pending a reply from the hospitals or the particular institutions. Yun naman ho ang SOP, hindi ho ba?
It's not an SOP. It's not an SOP. If you will look at that circular, there are two tracks that the findings can happen, because one, it can only be a quality issue. And if it is a quality issue, we give them notice of it and a notice for corrective allegation. Only when it goes to a legal track, when it seems like it's really fraud, that's when we go into the TSPC. Hello?
All right. Just as a last question, because I also have Dr. De Grano after, how many hospitals would you say right now are involved in fraudulent activities or may have pending cases?
I don't have the exact numbers right now, no. But since 2019 up to now, we have been able to implement a TSPC in around 19. I don't have the exact number, but a total of 26 providers. That's already including the hospital and a doctor. So 26 since 2019. Now we have several cases in our offices right now at our fact-finding investigation office, and it's moving to prosecution. So several cases there. I don't have the exact numbers at the moment, but it's several thousands of cases are being investigated at the moment.
Just
but those cases is equivalent to one claim, so it's not number of hospitals.
Okay, understandable. Okay, just want to get your confirmation on this, because there was already a report that PhilHealth has about 86 billion in outstanding claims. 26 billion of these have been processed. 86 billion in claims, not outstanding. 26 billion have been processed. 46 billion have been returned to hospitals for, I guess, further information and clarification, and almost 14 billion pesos denied. Can you clarify? Can you confirm this?
Yes, there is no such thing as 86 billion of utang ng PhilHealth. We have corrected that data. We have provided the associations with the corrected data. And so there's no reason for them to use that data anymore. Now, how did they arrive at the 86 billion using the old data? They added the in-process claims with the return to the hospital claims and the denied claims as
Opo.
PhilHealth payable. We shouldn't be, because denied claims are denied and returned to hospitals are with the hospitals for them to comply with the findings, and they can refile that with us. And therefore, it's not accounts payable from our point of view. Now, with that corrected data, we have 12.9 billion being processed at our offices now at different stages of claims processing. That's as of June 30.
And what else? So 12.9 billion being processed now. What else?
Yes, that's 12.9 billion. That's it. That's the amount in our offices now. As I mentioned, there are claims that were returned to the hospital because of deficiencies, and this is amounting to 9 billion. 9 billion. And there are denied claims amounting to 6 billion. But as I mentioned, the denied and RTH should not be the accounts payable of PhilHealth.
Okay. Ma'am Shirley Domingo, thank you so much for your time.
Thank you. Thank you for inviting me.
And we will be taking a very short break. We'll be speaking to Dr. Jose de Grano after the break. Stay with us. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, Private Hospitals Association of the Philippines, or PHAPI President, Dr. Jose de Grano. Dr. de Grano, very quickly, wanted to get your reaction doon sa, were you able to listen to my interview with Ma'am Shirley Domingo of PhilHealth?
Yes po. Yes po.
Okay, so let's start with that. Yung pong circular nila, yung 2021-0013, temporary suspension of payment of claims. She actually clarified this, that it's an old circular that's updated to actually give more due process to these claims. Is that clearer to you? And is it acceptable, or are we missing something?
Yeah, ang sinasabi po nila na dagdag, ano? Pero if you will read yung bagong circular po, ang previously in 2016, yung 0026 po, nakalagay po doon, they are given the hospitals are given 10 working days to answer. Ano po? Dito po sa bagong circular, ang nakalagay po doon, unextendable 3 calendar days. Ang laki po ng diferensya niyan. Ibig sabihin, pag pumasok po ng Biyernes, Sabado, Linggo, Lunes, kailangan may sagot ka. And then sabi nila, pag wala kang sagot, whatever, then it will be forwarded to the President and CEO.
A TSP order shall be approved by the President and CEO of PhilHealth. If no action is taken within 30 days from the receipt of recommendation, the TSPS order shall be deemed approved. So, ibig sabihin, hindi na makukuha yung claim na yan. But I remember, Ma'am Shirley was saying there was a 3 days and then meron pang 10 days. In fact, from my understanding, Dr. de Grano, ang sinasabi niya, na-extend pa nga ho ito.
If you will read dun sa general guidelines, paragraph B, a notice of findings shall be issued to the concerned HCP by the RBP or the fact-finding FEIED department. The HCP shall be required to file an answer within a non-extendable period
of 3 days.
Calendar days from receipt hereof. Ano po sinasabi na may additional 10 days?
Yeah. Yeah, I can read that. I know what you're saying right now. And sinabi pa nga, if the answer to the notice of findings lacks merit or no answer has been filed, yun yung sinabi ko po kanina, within the prescribed period, a TSPC order shall be recommended in the investigation report. Okay, so this is basically you're saying, why give us a non-extendable 3 days? This is such a short period of time.
Yes po. Talaga po. Ano yan? parang ano yan nasa na po dyan ang mga legal principle of presumption of innocence and our right to due process. Wala na po.
Opo, kasi 3 araw ang binibigay po sa inyo. But isn't there going to be a hearing on this tomorrow by the House of Representatives para po to reconcile this particular circular? Maybe there's just some things lost here or misinterpreted.
We're still waiting for the invitation, but until today po, wala pa po kami nare-receive na invitation from Congress.
How do you feel though that obviously you have 3 big organizations here already saying that kung magpatuloy itong circular na ito, the one that we are reading right now or the one that has been released, that you are thinking, these 3 organizations are actually thinking of disengaging from PhilHealth. Ano po mangyayari sa publiko pag mangyari ito?
Nga po ang ayaw namin mangyari, kasi sino po ba ang talaga maapektuhan ito? The patients. Because siyempre kung wala pong kung wala na pong PhilHealth accreditation ng private hospitals, pagpasok po nila diyan, sasabihin sa kanila, hindi po madideduct agad ang inyong mga benefits. Mangyayari po, i-advance yung payment at yung mga benefits nyo sa PhilHealth, you will have to file that directly to PhilHealth. At ang mangyayari po niyan, ang problema naman po pagka nagkaroon po ng problema at halimbawa na-suspend na po itong mga ospital na ito, siyempre problema din po naman ang pasyente at saka ang ating healthcare worker. Sila po ang apektado.
At ang hirap po nun, Dr. De Grano, for a patient to actually go to a hospital, tapos ang sasabihin ng hospital, pag mag-disengage ho kayo, I mean, this is the scenario I'm seeing. Pagpunta po ng hospital, sasabihin niyo po dun sa pasyente, sabihin ng pasyente, may PhilHealth ako, sabihin ng hospital, hindi kailangan magbayad ka, tapos bibigay namin sa iyo yung mga resibo at ikaw mag-reimburse sa PhilHealth.
Yes. Ganun po ang mangyayari pagka disengage po or hindi po accredited ang mga hospitals sa PhilHealth.
Okay, this again is something that I believe the House is looking to resolve between PhilHealth and the hospitals and healthcare providers. Just very quickly, I wanted to reconcile this number, Dr. De Grano. Sinasabi po ni Ma'am Shirley, ito po yung utang ng PhilHealth. 12.9 billion daw are being processed right now. Meron pong 9 billion are being returned due to deficiencies. I'm not sure if that's the word she used. And there's 6 billion that's denied. Is this a number that you can confirm because we are getting conflicting numbers?
Yan po ang huli nilang binigay sa amin. Yung pong dati na 26 billion, 46 billion at saka 13.8 billion ay yung po ay una nilang binigay. And then 2 days after our meeting, binago po ng PhilHealth, sinabi yung bago pong figures na yan after 2 days. Kaya po, yan po ang sinasabi nila na kanilang in-process claims ngayon na almost 13 billion.
Be happy, President. Dr. Jose De Grano, sir, maraming salamat po sa inyong oras.
Thank you po.
Thank you.
Pinky. Yes po.
And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.